For the first time in its history, the Red Cross has declared a national blood crisis.
Yeah, it's a bit alarming. The organization saying it's experiencing its worst blood shortage in over a decade. This January also happens to be National Blood Donor Month, everyone, and the Red Cross urging people to step up. So joining us live this morning is Mary Barneby. She's the regional CEO for the American Red Cross in Greater New York. So Mary, good to see you. Thanks for being here.
Good morning. Nice to be here.
So Mary, first and foremost, talk to us about the urgency in this crisis. Where does the nation's blood supply stand right now, and what is at stake?
Well, to let you know where we are right now, we have about 1 day supply of type O blood available right now for our hospitals. And that is really, incredibly low. We are working off a shortage that started back in the fall. So we haven't really recovered from that because of COVID and some other things that have kept people away from donating blood. Every 2 seconds, blood is needed by a hospital throughout the country to take care of people who are victims of emergencies, accidents, chemotherapy, sickle cell, helping transfusions for sickle cell disease. You just name it. There's a great need. And hospitals right now, many of them are operating at about 1/4 of the supply that they normally would have.
Wow, is COVID the only reason for this shortage?
Well, I think COVID is part of the reason for this shortage. I think the holidays typically become a time when people step back. We've had some cold weather, some snowstorms. So it's really important for people. And also, vaccination issues. People that maybe, are not vaccinated and are not in a position where they feel comfortable giving blood. But we have been operating for the last 20 plus months with donors throughout our country and locally in this area, safely working with them on collection of blood and platelets. So people should not feel concerned. We're following COVID protocols. We would love to have people step up right now and look for a blood drive near them so that they can help us with this incredible crisis. I mean, there are people not getting surgeries. There are people delaying their chemotherapy. It is really a crisis.
Yeah, I mean, it's the first ever national blood. We've talked about blood crisis before, but not on a national scope, right? So talk to us about the incentives you have right now going on for donors this month. We know the Red Cross and the NFL have a bit of a contest going on. So what's going on here?
Well, right now, if someone steps up and donates blood, they will have the opportunity to be in a drawing to go to the Super Bowl. And that is really incredible. We've done that for a couple of years. We have great partnership with the NFL. It's really wonderful. And also the people go to our blood donation sites and we have wonderful little incentives for them. But most of all, you leave feeling really good because you're doing something that really makes a difference and can save 1 pint of blood can save up to 3 lives.
For people that do want to give blood, do you have requirements for vaccinations, or do you do COVID testing as they come in?
Well, we were doing antibody testing. We're no longer doing that because of the higher vaccination rate that exists out there. But we do have, if you go to our website, you can find out all of the requirements. We are regulated by the Food and Drug Administration. So there are certain requirements that we must adhere to. And we take those very seriously to keep everyone safe.
Is vaccinations one of them?
Vaccinations would not be a requirement, but people must be wearing masks and adhere to social distancing and other requirements. Our staff are required to be vaccinated, though.
Right.
Now, I know you said that you were talking about different types of blood. Is there any specific or particular type of blood that you are in most short supply?
Well, we need them all.
Yes,
but
of course.
Type O is the most universal donor. And so if you're a type O, we need to as a priority right now. We also like to collect platelets that really help with people that need, really serious transfusions. And platelet production has certainly been lower because of the shortage in general.
Right. And let me tell you, everybody, if you've never been a blood donor before, it's so quick. It's so quick and it's so easy, and you're saving so many lives. Mary Barneby, keep us posted. Hopefully you get some donors this weekend. Thank you again for being here today.
Thank you so much. Go to our website and you can find a site near you.
Okay. Thank you very much, Mary.
Thank you.